I'm going to pull up this particular page. We're going to take a look at it together. So this is the skill that we're about to learn. Remember, we always go by the care plan. For us, it's the care plan, the whole care plan, and nothing but the care plan. So this care plan tells us to position the resident on his left side. Patient requires support to remain on his side and is unable to assist with turning. So the patient has to be turned, but they can scoot towards you. If you scroll down, they anticipate that this skill should take somebody with your level of experience about 8 minutes to do. This is a live patient skill for the test. That means that you may be doing this on a real live testing student. This person will be lying in bed. You're going to turn them over. Charting is not required. So when you're going to turn a patient onto their side, you need to get them towards you on the bed, either through the segment method, a draw sheet, a slide sheet, or just ask them to move if they can. You're going to put the furthest arm up, closest arm over, bend the closest leg, put the foot flat on the bed, and angle that furthest knee outward. When you do that, hand on the hip, hand on the shoulder, and just roll them gently onto their side. And it's no stress at all. You can move somebody 3 times your body weight using that method without hurting them or you. So it's something that I want you to try. It's actually kind of fun to get them in the right position and notice just how easy they turn. But the problem is that gravity on planet Earth will always pull a patient back onto their back. Always. Because most of our weight is situated along the back side of our body. So when we're laying on our side, gravity is going to try to pull the patient over back onto their back. We don't want that to happen. So we're going to use some pillows to kind of keep them in that place. We're going to use a pillow as a roll along the back to keep them in that position. If you don't, turning them on their side really isn't going to be very effective because they won't stay in that position for very long. Now, this is actually very, very important because if you've got a patient who cannot move on their own, so either they're super weak or they have mobility issues, or maybe they've had some trauma, an accident, and they're unable to move, or maybe they had a stroke and they're unable to move. Whatever the problem is that brought the patient to this point, it's up to us to try to prevent bed sores from occurring once they are immobile or have limitations in mobility. So if we have a patient who can't move on their own, we're going to be responsible for changing their position every 2 hours around the clock. So that means at 2 a.m., we're waking them up and turning them over. At 4 a.m., we're going to go in and wake them up again and turn them over. At 6 a.m., turn them over. At 8 a.m., turn them over. At 10 a.m., and so on. Every 2 hours around the clock, their position has to be changed. And this will help cut down on bed sores, but always, always, always follow the care plan. Because as a nurse, I do have some patients that are way more fragile. Either they don't have good protein intake or they have lost a lot of muscle mass and it's bone pressing against skin. Maybe they have some underlying conditions that I'm concerned about. Maybe they're in the dying process. My care plan for that patient may have us change the position every hour around the clock. So remember, every 2 hours is standard, but your care plan can always change based on the needs of that particular patient. Never forget that. Always consult the care plan. But generally speaking, it's going to be 2 hours around the clock. But when you're turning a patient, you're going to go from their back 2 hours later to their right side. 2 hours later, back to their back. 2 hours later, left side. 2 hours later, back to their back. Right, back, left, back. Right, back, left, back. The only time you ever put a patient on their stomach is if the care plan specifically tells you to. Now, right now, we're dealing with a lot of COVID patients, and we have found that we get very good ventilation response from patients by putting them on their stomach in a prone position. But that doesn't work for everybody. In fact, there are some patients that if you put them on their stomach, you can actually suffocate them because their nerves or their muscles are unable to lift themselves off of their chest cavity for their lungs to inflate. So the only time that you put a patient on their stomach when you're changing their position is if the care plan specifically instructs you to. Otherwise, we don't use the stomach. Now, one of the things that I want to bring to your attention with this particular skill is that the pillow, when I show you this skill on the video, and this is one of the kind of the downfalls of having a virtual class, okay? When I show you this skill on the video, you're not really going to get a good feel for just how hard it is to put this back pillow in place. Now, if you were standing here looking at me, you could see what's required to get this pillow to stay in place. But the video doesn't really fully show the difficulty level here. So when you turn the patient on their side, remember arm up, arm over, leg up, leg angled, you turn the patient over on their side and you put the pillow underneath their back. You're going to lay the pillow against the back and then you're going to tuck the top edge under the patient as far as you can get it. You want that pillow tucked way under that patient's side. Then you're going to fold the closest edge to you up and over, and you have to tuck that under as well. And when I mean you need to tuck it under, you need to tuck it under the patient, as far under as you can get, because you need their body weight to hold down those two edges of the pillow, or it's going to pop back out. Now, during the test, if that pillow pops back out, you have to address it. You need to go back and retuck it. This is not as easy as I make it look. So kind of keep that in the back of your mind that this skill is going to require a little bit of practice on your part. Now, after you get the back pillow in place, you're going to put one in between the legs, but specifically between the knees and the ankles. You need to make sure that those bony areas aren't going to rub together, because if you have a knee and a knee that's rubbing together, those bony areas can cause bed sores to form. Same thing with the ankles. So that pillow you want to lay lengthwise. Make sure that part of it is between the knees and the other part between the ankles. Now, you're going to go around to the other side of the bed and you need to put a pillow under the top arm. And this gets that arm in a neutral position, because otherwise the arm kind of sags down, can put a lot of pressure along the back and up into the neck. And then the one pillow everybody forgets about is the one that's already on the bed. When you turn a patient over onto their side, chances are that bottom shoulder is going to be laying on that pillow after you turn them. So you need to adjust that pillow so it's just under the head and neck and not under that bottom shoulder, because that'll scrunch the shoulder up. And again, it can cause muscle spasms, headaches, and other problems. So when you turn the patient, pillow behind the back, that's the hard one, pillow between the knees and ankles along the lower leg, pillow under the top arm, but don't forget the one already on the bed. Adjust the pillow under the head so that it's just under the head and neck. When you have an immobile patient, it doesn't mean that they're unconscious. And one of the things that I see with this skill a lot when people are practicing it is they don't talk to the patient. This is a skill you need to talk to the patient. You are putting your hands on another person's body and you are moving that body for them, which means that, you know, realistically, this can be a very scary thing for somebody who doesn't really have the ability to move on their own. So when you're doing this skill, I know you're all up in here, you're in your own brain, right, during this skill. Please make sure that you talk to the patient through it. You tell them what you're doing. And that just makes things go a whole lot easier. The patient will relax a little bit. They know what's happening. They'll cooperate to the extent that they can. But talking to the patient is a really big part of this skill. This skill will also require a privacy blanket. Remember, anytime a patient's uncovered or undressed, we use that privacy blanket right here behind me. Because we're going to be turning the patient and putting pillows in different areas, if you leave the sheet on the patient, that sheet kind of gets in the way. you can do this using the sheet that's already there, but it does get difficult because the sheet is tucked into the bottom of the bed and it kind of impedes your ability to put the pillows in the right place. So you have two choices. You can either untuck the sheet and keep it over the patient, put your pillows in place, and then retuck the sheet. No problem with that. Or you can use a privacy blanket, pull the sheet down to get it out of the way, and then remove the privacy blanket at the end. Either way is fine. They don't really care which way you do it. Just make sure the patient remains covered as you do this skill. So this is something that I hear a lot, people that say, I can't believe I failed the test. I got that side position thing and I turned the patient on their side and I was confused. I just turned them on the wrong side. I don't know why that should fail me. Well, the reason that that fails you is all about pressure dynamics. So for the next 2 minutes, I want you guys to play along with me. I want you to take one of your hands. I don't care which one. Just take one of your hands and sit on it. So put it underneath your leg and sit on it. Now it's going to become very uncomfortable for a few seconds. But at 9:55, I'm going to ask you to remove your hand and we're going to take a look. But this is going to illustrate pressure dynamics. Now, the reason that this says left side is because the patient has been on one of their other sides for quite some time. In a clinical setting, for the most part, we change a patient's position every 2 hours around the clock if they cannot change their own. So this would be somebody who is super weak or maybe is paralyzed or has some mobility restrictions. So if this is somebody who cannot change their own position, we are going to be tasked with changing that position every 2 hours around the clock to change their position. Now, why would we have to do this? Well, when you're on one position for very long, gravity on Earth is trying to pull you down to the Earth's center. So there's a lot of pressure pulling you down. So your entire body weight is being pulled down through the surface that you're connected with. Okay, so one more minute, guys, almost there. You're probably uncomfortable by now. So all of that pressure on one surface for a long period of time can actually cause that area to break down because it's compressing all the capillaries, the muscles aren't getting good blood flow, the skin is starting to die. So when you have a patient who cannot change their position, all of that pressure is squishing that area that's connected to the chair or the bed or whatever the patient is on. Take your hand out and take a look at it. Do you have any color changes? Is your hand red? Now look very, very, very closely. Can you see the pattern of the surface that your hand was on? So can you see the pattern of the fabric or your clothing? There should be like a pattern imprinted.
Yes.
That was only 2 minutes. 2 minutes. Now, think about this. If you've got a patient that is on that surface for hours and hours and hours, you got lines in 2 minutes. How deep do you think those lines are going to go? Over hours. They're going to continue to cut in and in and in and in and in, and eventually they will actually break through the surface of the skin because those lines just get deeper and deeper and deeper. This is how pressure sores occur, is when you have a patient who cannot move and they're connected to a surface, whether it's a chair because they're sitting or a bed because they're laying, over time, all of that pressure is going to cause whatever's underneath to imprint more and more and deeper on the surface of the skin. And then eventually it will actually break the skin open at that point because the lines are so deep. And that is a pressure sore. So it's important that we understand that if a patient cannot move on their own, we are going to have to turn them on a prescribed schedule. So remember that every 2 hours is kind of our benchmark standard, but the nurse may change the care plan to every hour if there are significant additional risk factors to help prevent bed sore formation. Remember, every 2 hours around the clock. Back, right, back, left, back, right. So if our care plan says to turn the patient onto the left side, that means that they were on their right side for 2 hours already recently. So if we make a mistake and put them back on their right side, that's additional pressure in that area that will probably result in a bed sore formation. So saying something like, well, I just forgot and I put them on the wrong side, it's not that big of a deal. I did the skill right. It is a big deal to the patient because that patient might end up with a bed sore. So you see how things that might seem small to you when you're testing actually turn out to be a big deal for the patient, and that's what they're grading you on. So if you have an immobile patient, you need to know the care plan will always have you turning the patient. But what if? Because sometimes the nurses get a little distracted when they're doing care plans, right? They got a ton of stuff to think of, a lot of things to remember. And what if they get interrupted as they're creating a care plan and they forget to put turning a patient every 2 hours, and you come on shift and you notice that a patient is immobile, but there's nothing on their care plan that says to turn them every 2 hours around the clock. What do you think you should do? That's right. You need to bring it to the nurse's attention. And the nurse will probably say, oh my gosh, I can't believe I forgot that. Yes, let me get that on the care plan. Please turn the patient every 2 hours around the clock. So I'm going to show you this skill, but this is one that you really want to make sure that you're practicing because it's going to look really easy in the video, and it's not quite as easy as it looks.